Hello everyone. Today we have with us Dr. Radhika, who has secured such a good rank despite hectic internship and first attempt. So first of all, congratulations, Radhika. So how are you feeling now?
Thank you so much, sir. Sir, I had a teacher and he used to say that your biggest asset in life is how many people have expectations from you. So more than my rank, when I went and I told my PGs who have supported me all throughout the years, when I told my parents, when I told my friends, the happiness on their face, sir, that gave me much more satisfaction than the rank itself. That is what made me very, very happy. So it was all worth it.
Yeah. So tell me about yourself. You are from which college?
Sir, I'm from Jawaharlal Nehru Medical College, Belgaum. It's a private college, sir.
Mhm. And when did you start your preparation for NEET PG, or when did you decide to start your preparation for NEET PG?
I decided to start my preparation the day I got my admission in private college. That was the day I thought, okay, fine, I have failed this time, but the next time, in after 5.5 years, I'm gonna win. And properly, I started my preparation when I joined DAMS in second year, and in the entire 5.5 years, I think that was the best decision I have made. It really changed how I studied. It helped me a lot, not just from a NEET PG point of view, from everything. It helped me solidify my concepts, sir. Also, I have seen some other sources and I can see the difference, the way DAMS teachers teach us and the way other platforms recorded videos teach us. They are just giving us notes. But when I used to attend DAMS classes face to face, satellite, I remember I went to your 12 hours ECG class from morning to night, and I had university exams 1 month later. Time flew by. For 12 hours, I did not feel that this is a burden, this is too much. So dance has that quality. It actually, they teach you, teaching in the truest sense, not just giving you notes for NEET PG.
Okay, so that
Then
means
in
you
second year,
started early. You started early. You started with your pre-foundation, and during your pre-foundation days, you used to make notes in the class, and you used to revise those notes.
sir, I used to have classes on Monday and Wednesday. So I remember my first dance class was taken by Dr. Diksha Sikri, and I fell in love with dance that very first class. It was so amazing that those 4 hours, I went back, I opened my Robbins. The best thing about dance is they always tell you to, read the standard books. You always told to read Harrison, and that's what I did. No other book, just Harrison. So I used to go back after 4 hours, 5 to 9. Then I used to revise whatever ma'am has taught us. The next day would be a gap. So that one day I would read the Robbins Wala chapter, whatever ma'am has taught. And the next day I would try to, if I had time, I would try to read beforehand whatever ma'am was going to teach in the next class. And then the rest of the week, I would just try to revise it as many times as I can. I used to read Robbins as many times as I can. So the whole year, DAMS gave me a very good schedule to stick to.
Okay, so you made
That
a
was a
proper
huge
timetable.
advantage for me.
You made a proper timetable, means before the class you were well prepared. What faculty is going to teach.
Yes, sir, definitely.
Yeah, and that pre-foundation course helped you in your university exams also.
Definitely, sir. Half of my answers were from DAMS notes only. They were so good.
Okay, and in the third year, you joined the foundation course and the major
Yes, sir.
subjects you did. So, tell me, how do you get that time to manage your university as well as the DAMS foundation with major subjects like medicine and surgery?
Sir, it's all about how many hours you're ready to put in, what your priorities are. If you are ready to prioritize your study, you will get enough time to manage both. But personally, I have always been more oriented towards NEET PG since this became my goal from the very first day. So, and since DAMS taught it so conceptually, notes were the best. I mean, if I'm reading medicine, I first read it from DAMS note, then I go to the same chapter in Harrison, I read it. It takes half the time. because you have taught it so well. That helped a lot. Basically, smart work, doing smart work. And
Yeah.
yeah,
Hmm.
1 month before university,
Uh-huh.
I
And
would concentrate more on theory, but
more
all
on
the year
theory.
round, I would concentrate more on reading standard books and trying to understand the concepts.
Okay, so that means ki, you started early and you started making your concepts. You supplemented DAMS class with the standard books as advised by your faculties. And what about your final year? I think in final year you attended test and discussion.
Yes,
Yeah.
sir. A lot of people advised me against it, but
Mhm.
I never listened to anyone, and thank God for that. I didn't listen. I was already done, at least making all my notes. My notes were complete. AIIMS notes are gold standard. They were concise, crisp up to the point, and directly taken from the standard books. And I'm always a fan of reading standard books. I advise all my juniors to read standard. They don't listen, but I still do that.
Okay, so you follow it with a test and discussion, and after test and discussion, you gave grand test, you gave CBT test also.
Sir, not in final year. Final year, I only did TND and I concentrated more on fourth year subjects TND and third year subject TND. Then in
Mhm.
internship, I gave
Internship.
all three CBT, sir. Plus
Mhm.
grant test. I started giving grant test in internship during mid of my first reading.
Okay, and initially in your grand test, what was your rank or score like?
Sir, the first GT I gave, you won't believe it, the first GT I gave, I only got 97 correct. And
Okay, so how did you improve after that?
I was so disheartened because I thought I have done TND in fourth year itself. I should have an edge over others. And I was really disheartened. For 1 month, I battled with all my negative thoughts, especially since I'm from a private college and I don't have a lot of achievements to back me up. But in the end, I finally told myself, forget about result. You just work hard. You let go of the result. I did that. And then I I gave it everything. I just read and solved MCQs. And then finally, after 2 months, my GT score started improving. First week of October, I completed my first reading, sir, and that time I got 116 correct. And then at the end of December, I got 130 correct. And then at the end of January, I got 137 correct. And then finally, the last CBT, mid of Feb, I got 146 correct.
Okay, and what about the CBT two?
Sir, CBT2, I think I got 120 correct. And then CBT3, nearly a gap of 15 days, I think. I got 146 correct.
Okay, and coming to your exam day. So just before your exam, what was your means ki, schedule, or you did the revision, you did the theory, you did PYQ or DVT just before your exams, say 10 to 12 days before your
Sir,
exams?
the last 10 days, sir, I only did DVT. This DVT book is a game changer.
Okay.
I only wish that it had this event had occurred earlier because it was such an advantage. I was so happy that DVT is an option for us. And the last, I added all the PYQs in that DVT book itself. I made DVT only my 20th notebook itself. I added pages in it, whatever points I was forgetting. And then the last 10 days, I only did DVT. And the last 1 day, I had few sheets of paper which included all the things I kept forgetting. That was it, sir. And then
That means
these
ki
days.
DVT and PYQ were the game changer
Yes,
for
sir.
you, means the
Yes,
defining
sir.
point for you. Okay,
Definitely,
and
sir.
on the day of exam, how were you feeling? Means you were feeling nervous or confident or excited?
Sir, around 30 minutes before I had to go in, one of my batchmates approached me and she said all the best. And she was the one who had been with me in all my postings. She's a roll number right next to me. So when she came and hugged me, I started crying for some reason. I was so scared. But she was so supportive. Everyone was so supportive. Many of my batchmates were there. They came to me. They said, all the best, everything, you'll do well. We have seen you work hard. That gave me a lot of emotional support. And I have a friend, sir. Her name is Smiley. One day before exam, I was really, really scared. She sat with me the whole day in my room while I was studying. So I could not have reached here if it was not for my family and my friends and my relatives. I think my hard work just constituted 50% of it. The rest 50% was everyone else who has contributed to this
Blessings
success.
and emotional support.
Yes,
Yeah.
sir. Yes, sir.
Okay. And about your exam, how many questions you attempted?
I attempted 195, sir. My
Mhm.
brother, he's in AIIMS Delhi, sir. He had attempted 193. So when I talked to him, I was like, what have I done? I think I have attempted too many questions. I have taken guess too much. I'm gonna get a lot of negatives. I was really scared, but
Okay.
I guess it turned out to be for the best.
And according to you, exam was easy, moderate, or on a difficult side?
Actually, the first half of the questions that I got, some of them were slightly tricky, which I did not expect after giving the NEET PG 2022 recall. So my mindset became that this paper has a bit of tricks in it. So in the second half of the paper, even in the very easy questions, I overthought a little and I thought, no, this must be, they are going somewhere else and I marked the wrong answer. But now that I think about it, I think it was a fairly easy paper. The number of repeats that have come and seeing the cutoff at the same score, it's almost double. So it was definitely, sir, easier paper, I think, from
Easier,
last
and
time.
it was not lengthy.
It was not lengthy, sir.
Not lengthy, yeah. It was not
It
a
was not lengthy, sir.
huge clinical case scenario. It was mostly a 2-3 line
Very
type
simple,
of.
sir. All the
Hmm.
clinical scenarios were very easy. I think if clinical scenarios come, then you are definitely at an advantage because you get so many clues.
Yeah, yeah. And now on the result day, when you saw your result, how was your feeling? Means you were numb, or you have excitement, or hmm.
So actually, I was numb because I wanted a rank of under 1,000, and I wanted it along with my internship year. That was my goal, no matter how impossible it seemed. That was my goal. So at first, I felt numb, and I told my parents. They were so happy. That made me a little bit happy. And then when I told everyone else, people who love me, I'm not told this rank to my batchmates yet. Uh, So that made me much more happy. Now I'm not satisfied with my result. I think I could have done better, but I'm happy with it. Like I'm gonna get. I think I might get radiology, so it's fine.
Yeah, no, because you did your MBBS, you are in internship, you did your MBBS final year from the private college. Secondly, it was your first attempt, and third is hectic internship. So
Yep,
with
sir.
so many factors, you achieved a great rank, है ना? So
Yes,
this is
sir.
a great rank for the first attempt. And what are you planning to take? Radiology?
Yes, sir. Radiology. The day I finished my fourth year and I got into internship, I had set my mind on radiology. I was very passionate about it. My PGs would ask me, what are your second and third option? I would say radiology, radiology, radiology. That's it. I don't want to do anything else.
Yeah, so you are clear in your mind ki you want to take
Yes, sir.
this. Okay,
Yes, sir.
and
Nothing else.
yeah, and for your juniors and NEET aspirants, NEET PG aspirants, what advice would you like to give?
So from what I've heard, especially in my college, people have already given up even before internship has started. Because there is some kind of culture here where every PG will tell you, almost every PG will tell you that it's not possible to get a great rank on your first attempt, especially during internship. Internship is for working, this, that, everything. So my advice would be to forget about everything else. Nothing else matters. It is a difficult journey, but I always believe that this is something that I have read. There is no easy way from the earth to the stars. It is supposed to be difficult. So you have to go through it. And if you do get through it, you're going to come out with shining colors.
Yeah, and a right attitude is most important. Ki,
Yes, sir.
yeah, in this negativity, people are telling you negative things. So you have to think about yourself, your dream, your career, and do not go in believing other people's negative point of view. Yeah. And how do you manage your studies during your hectic internship? Means ki, you used to do MCQ during ward duties or notes or DBT workbook?
Sir, I think what helped me achieve this rank was that extra 1% I gave every single time. It takes 15 minutes to walk from my hostel to the hospital, and there is not a single day in which I have not studied for those 15 minutes. If there are rounds going on, I live in Karnataka, so the rounds always occur in Kannada language. I don't understand that. So there is no point just standing there. I would stand at the very back of the crowd and I would always have a paper with me and I'm always studying even during rounds. We had peripheral postings at PHC. It took 1 hour to travel in the local bus. I used to go by the local bus. I would open my book there also. I would study then also. Even during night duties, sir, which would sometimes happen 2 times in a week, if I'm getting half an hour at 1 o'clock at night, I would open my book right there. I would open my phone right there and I would study. I never missed even like 5 or 10 minutes. If I'm getting 5 or 10 minutes, I am going to study no matter what. And a lot of PG, sir, they did taunt me a lot about it. Ki, why do you keep doing this? This is not good. This is not how you should behave. But I just ignored them all.
Yeah, so that means ki you utilize each and every time because everyone has got 24 hours. है ना? So,
Exactly, sir.
yeah, this is a great motivation for our audience ki in spite of hectic internship, you can, even if you are getting 15 minutes, utilize that
Yes,
time
sir.
for your study and for your
Fifth,
preparation.
sir,
Yeah,
my Mosaji used to say, my Mosaji told me this few months ago that every 5 minutes you waste is one MCQ. You can revise biomedical waste management in 5 minutes. You keep those things in your phone, you keep papers in your pocket, and whenever you get time, you open that paper while walking or anything, and you do that one MCQ.
yeah. So that's a great advice, and not only for you, but for our future NEET aspirant also. Ki 5 minutes is one MCQ, and one MCQ if you add each day.
Exactly, sir. It
Yeah,
makes a
yeah,
lot
yeah,
of difference.
yeah,
Every
yeah.
single MCQ, especially in the top 3000 rank, one MCQ is equal to 500 rank upper niche.
ऊपर नीचे, yeah, yeah, yeah. All right. So, and I can remember that in 2020 or 19, I came to your
2020,
college.
sir. Just
Uh-huh.
just before
Just before
lockdown,
the
sir.
COVID, and I met you, and you were those bright student who is always looking after academic, who is after knowledge, and who is more interested in the clinical ward rounds and their history taking. So that I can remember, and from that day, I knew ki you will be getting a good rank and in your first attempt. Okay.
Thank you so much, sir. Thank you so much.
Yeah, and some motivational word for your juniors or for your future NEET aspirants.
Sir, I would just like to say something that Saurabh Jindal sir said in one of his TNDs that helped me a lot. He said that when I gave my first attempt, he spent the entire year worrying about his rank, always spending energy on I want derma, I want derma, I want derma, and but he couldn't do it in his first attempt. So the next time. He started focusing more on how much effort he's putting every single day. So what he said was, be effort driven, not result driven. So that helped me a lot because I was worrying about my rank too. So instead of spending energy there, I start every morning when I would get up, I would think, if the thought came to my mind, Radhika, are you gonna get that rank? Are you gonna get it? Are you gonna get radiology? Forget about that. Think about today. What is your plan today? How are you going to study today? So that helped me a lot. And more than that, also self discipline. I was a very average student, sir. I have never scored distinction in college except OBG. It took me 5 years to develop self discipline. After every MBBS year, I used to evaluate what have I done wrong in the past year, where am I lacking, why am I not one of the top students here. Every year I would analyze something and I would try to improve on it. So that helped me a lot, that even if I'm feeling boredom after 2 days of studying for 12 hours, yeah, I would, basically I got very used to it. So in the last 2 months when I was studying for 13, 14 hours a day, it didn't feel like I can't do this anymore. I
Mhm.
became so used to studying so much. So initially, everybody is going to feel that resistance, but you have to just push through it. That is called self discipline. And you need to take a specified amount of break, which should be scheduled. Like, if you're taking break, it should be on a Sunday or whatever day you choose. After you work for 6 days in a week, then you take your deserving break. You'll feel more happy instead of randomly breaking down in the middle of the week and then feeling guilty about it. I did not study. That's a vicious cycle. You'll never feel relaxed that way.
Yeah, so that means the reason for your success is early preparation, consistent efforts, and most importantly improve on your weaknesses. Ki whatever you have done earlier mistakes, now you will not do it again, and each day counts, and you didn't waste any time, means you utilize each and every single minute of your internship in preparing for the exam. So these are the take home messages for our audience. And thank you so much, Radhika, for taking time out and have a
No,
chat
sir,
with.
sir, I am honored because I never thought that this was going to happen, but it did, and I'm extremely happy, especially seeing your happy face. It's making me so happy.
Yeah, and convey our regards from our DEMS family to your parents, to your friends. We are also proud of you, and all the very best for your future, for your career. And thank you once again.
Thank you so much, sir.